Okay, Dr. Rob Muller. So why do people have a hard time opening up about trauma, even with their therapist?
Well, I mean, I think one of the things about trauma is that it really has a huge impact on your ability to trust. I mean, this is something that would be probably in many ways obvious to listeners. I mean, when people have really suffered from interpersonal trauma, they've really been affected in an emotional way, in a way that impacts their sense of how they think about people, how they think about the world of relationships, how they think about their place in relationships. And very often, what you have is this tendency to want to protect yourself, to want to hold back, to want to feel safe. So often, when people have had trauma experiences, they have felt unsafe. And then afterwards, they have felt unprotected very often when they've told other people about their traumatic experiences, either gaslit or having their experiences minimized. And so there's a tendency to really struggle with trusting people. And so opening up in many ways is, you're asked as therapists, we ask clients a lot when we ask them to trust us, when we ask them to open up to us, we're asking them to take a risk. It's scary. It's something that could be potentially dangerous in some ways, emotionally dangerous. And so, yeah, they hold back, and so opening up becomes a real process, and it becomes a real challenge. We have to pace the process, take it in a very slow, measured way. And when we do, though, when therapists do, so I'm speaking about we, meaning therapists, because I'm speaking from the perspective of a psychologist working with trauma clients. When we do that, when we take it slow, when we pace the process, then people are in fact able to open up. And there's a part of them, of course, on some level, that really wants to be understood, that wants to be given an opportunity to open up, that wants to be able to lift this burden off their shoulders, this trauma that they've been carrying around, this secret, this struggle that they've been carrying around. They want to lift that burden off their shoulders, but it has to be done in a way that is measured, that is paced. Yeah, so that's why.
God, yeah. So it seems like the main thing here is that they've told people about this, or they've slightly mentioned it, and they've been gaslit, and then they've pretty much got a response that made them feel like it's not safe to truly open up. So because of that experience, they tend to kind of, like become a bit, fully aware on how to keep themselves safe and not feel like, I guess, they're not worthy if they open up and truly tell people about how they're feeling, right? It's just the whole concept of they just didn't feel safe telling people. Is that the main thing, or
Yeah,
is
for
there
sure, for
anything
sure.
else?
Well, that's probably the main. Yeah, if you're going to put it down to one word, I would say safety is the big one, and I agree with you. Sometimes they have tried, like, I mean, it's interesting. Some people who have trauma histories from a young age, let's say, or from even, let's say, their teenage years, they have tried telling a friend, or they have tried telling a boyfriend, or they've tried telling a parent, or something. And yeah, sometimes people respond well. So that's, when people respond well, that makes a whole lot of difference. When people don't respond well in response to that disclosure of a trauma history, that can cause the person to clam up then for years and years, and then they really feel stupid for having shared. They'll blame themselves. They'll even, they'll say, I'm such an idiot for, like, why did I trust someone, like, why didn't I just leave well enough alone? And so, yeah, it really makes a big difference how people respond, and that sense of safety is very important as an emotional kind of experience. So, yeah.
Got it. Okay.